Good afternoon, everyone. My name is Tim Gillette, and I'm the Chief Operations Manager for the Child Welfare and Self-Sufficiency programs. I use the he, him pronouns. Before we get started, we want to cover a couple technical details. We do have live captioning available today, as well as ASL, as you can see on your screen. This meeting is being recorded, and the notes will be sent along with the recording to anyone who is registered after the meeting. Please take a moment to take our poll. There should be a couple questions on your screen. And then we're happy to take comments in the chat below. So if you click on the chat button and you just want to provide a comment that everybody can see, we love that. If you have a question specifically for us that you'd like to have us answer or possibly follow up with you afterwards, there is a Q&A button on the bottom of your screen as well. So please use that for any questions that you're hoping to get an answer to. We do have a couple Q&A questions that we're hopefully going to get to that we've gotten beforehand. And then if there's time, then we would possibly be able to answer any other questions that we receive during this webinar. So I'm excited to hear what we have to talk about, and Rebecca is going to get us kicked off. Over to you, Rebecca.
Thanks, Tim. Good afternoon, everyone. I am Rebecca Jones-Gaston, Child Welfare Director, she, her pronouns. Thanks everybody for joining us on our community connection today. And really want to just, provide an update to this never-ending transition story of mine that is happening, and just let everybody know that I don't actually really have an update. I am still here and still waiting and still happily doing work in Oregon on behalf of Oregon's children and families. And we will keep you updated if and when that changes. But absolutely excited about today's conversation. First of all, today, May, actually, this month is National Foster Care Awareness Month. If you're a resource parent or caregiver, if you're a relative caregiver, if you're a community member that is a resource for children and families connected to child welfare, just thank you so much for everything that you do every day. Your commitment, your dedication, your partnership, and your hard questions sometimes, and the hard accountability that you give us to serve the children and families that we collectively work on behalf of. We acknowledge that these last couple of years have been particularly unique for a hard job as it is of parenting, and just really appreciate the work that you've been doing with us. Your voices drive us and the direction that we're going in child welfare, along with the voices of the families and parents that we're serving and the young people that we care for. And just to note, next month is Reunification Month, which is an opportunity for us to also celebrate the permanency that results in children being able to be returned home to their parents, and all of the work that goes into that. And so we look forward to talking more about that down the road. As you may or may not be aware of or remember, I joined the Oregon team a few months before March of 2020, and I've been referring to it as the before times. And then April Flint-Gerner, one of our deputies, joined as we were all moving into this new world around managing life in a pandemic, which meant that she and I, not from Oregon, hadn't really gotten a chance to meet people in person, see the state and all of its glory. And I wanted to kind of report out that she and I have been on this road trip adventure around the state over the last few weeks, getting an opportunity to meet some of you, getting an opportunity to sit down with some of our workforce, our families, our partners, our tribal partners. And it really has been delightful and energizing and inspiring. And has added a great deal of energy, I know for me, in just thinking about what our possibilities are as we work together towards the vision for transformation. So before I turn it over to April, I do want to give just some high-level information about some of the legislative concepts and policy option packages that we are in the process of considering and compiling. And the core message in all of this is the vision for transformation is our touchstone, is what is the filter for all of the things that we're considering, the ideas that are generated, and really wanting to continue to think about what is it that we need to do our really good work now, and what are the things that we need to have in place as we continue to build forward into a prevention and preservation system together. And so there are a number of things, and we will in our next community chat talk a little bit more in detail of the refined ideas, but really wanting to focus on continuing to build a workforce that has the skills and resources that we need to do the work, and on behalf of children and families, our ability to engage with our community partners and have diversity and diverse perspectives at the table with us in all aspects of what we do. Some opportunity for us to reflect on some of the things that might be in the books driving child welfare that we want to revisit with a lens of equity, with a lens of preservation and minimal harm to families and ultimately our future state, as well as opportunities for us to be able to utilize our data and information and really get better about talking about our narrative in its full color. The things that are challenges and hard for us, as well as the things that are going well that absolutely should be celebrated. And so we look forward to talking with you more along that journey as those get developed, getting input from all of you, as well as talking about what the additional needs are as we go through this legislative process. And if anyone's like me, it's sometimes mind-boggling to know that we just finished one cycle and we're already talking about the next cycle. But that's how it goes. And so we are deep into discussion and planning for the legislative session of next spring. So today, during this community connection, we're going to provide some updates on a couple of things that we've provided little nuggets of information about earlier. Our new resource and adoptive family training, otherwise known as RAFT, our family preservation and the kickoff of our demonstration sites, and our continuous quality improvement updates and opportunities, again, as Tim mentioned, to answer questions, share your ideas and thoughts about what else you want to hear in future virtual sessions, and information that you would like us to share. So with all of that, I will just say it is my pleasure to be here today. Thank you all for joining us, and I'm going to turn it over to April.
Good afternoon, everyone. April Flint-Gerner, she, her pronouns, Deputy Director with Child Welfare over Equity Training and Workforce Development. With this month being Foster Care Month, I couldn't be more pleased to talk about our Resource and Adoptive Family Training, or RAFT, as we call it. And just to give a little bit of overview of what you can be expecting in the next few months as we launch and implement this new program. So first, I wanted to thank all of you who shared your time, your feedback, your ideas, and your voices to help better support what we consider our greater workforce, which includes both our staff and our resource and relative resource and adoptive parents. We have new curriculum that we're launching, and this work is really in alignment with our Vision for Transformation Guiding Principle 2, which is around enhancing our staff and our infrastructure. And so as part of the launch of RAFT, our Resource and Adoptive Family Training, we are revamping and have revamped our orientation, which is the initial training to resource and pre-adoptive families. And we are going to be launching that orientation training. And it's about an hour and a half long. It covers topics related to, who we are as ODHS Child Welfare and who we serve, our expectations of resource families, of coming alongside of us and supporting equity, supporting reunification, supporting well-being, helping children feel like they belong, and how we partner with our families just to serve Oregonians. And so part of that orientation and the development of this curriculum also has included voices and perspectives from our different communities. And it's been updated to really support the evolution of practice and policy, our vision for transformation, the importance of equity, our Oregon Indian Child Welfare Act implementation, and how our resource parents can support us with that, and to support kind of the wide, diverse needs of the young people that we're serving, and making sure that we are attending to their unique needs. And so we are launching some of the new training in the next month. We have opportunities for delivery in both Spanish and English, and we will be growing out our ability to offer the training in additional languages in the future. Next slide. So just a little bit more about what to expect from RAFT. So you all may be familiar with our longstanding resource parent training that we called Foundations. That series was developed in 2005 and has been a training requirement for all prospective resource families, and folks were expected to complete that training within 12 months of certification. The new curriculum, RAFT, is a curriculum that's derived from a national curriculum out of Spalding Institute called the National Training and Development Curriculum. And I know that we're going to be adding the website to the chat here so that you all can access that website and look a little bit more about NTDC, as we call it, the National Training and Development Curriculum. And it has been adapted to meet Oregon's specific needs. So we took a national curriculum, body of curriculum that had been developed with partners across the nation, and really adapted it for Oregon, and added some additional Oregon specific content that's not already covered in that curriculum. And so it has been developed, as I mentioned before, with resource parent, adoptive parent, and youth and tribal voice. And so we're really excited at this partnered opportunity to evolve the curriculum. RAFT is a series is 9 3-hour sessions, totaling 27 hours of training. So this is an increase from the 24 hours that was previously incorporated into foundation training. And like I mentioned before, it has been developed with the values and principles of the Vision for Transformation and national best practices. So the difference in this content compared to Foundations is the focus from the start and throughout about recognizing the unique identities of each child. And so that means that culturally, racially, linguistically, sexually, that the focus on resource parents to practice cultural humility and exploring and celebrating the multifaceted identities of the children that we are serving. There is also a high focus on partnering with a child's family of origin and birth family and their tribal nations throughout their experience in foster care. Because we know that separation and loss are just an aspect of the work that we do. And we want to make sure that our resource parents have the training that they need to understand how that might be demonstrated through behavior and how we can increase a sense of trauma response and belongingness for children that we're serving. Another one of the changes is that we are incorporating an evaluation process into this training delivery, as we are going to be doing evaluation, development and enhancement across all of our training delivery. And we want to make sure that both that the training is received well, that our trainers are well prepared, and that we are able to incorporate feedback around their development. We also want to make sure that the content is up to best practice standards and latest research. And we also want to make sure that people are learning. And so as we incorporate a continuous quality improvement into our training process, we may see some adaptations over time based on that evaluation. Next slide. So a couple of last things, and then we'll move to the next topic. But I just wanted to kind of talk a little bit about, it's not just the content that has evolved. We are growing out our ability to really adhere to adult learning best practices. So there's going to be lots of different formats and content delivered for different learning styles. We have and are making several just-in-time videos and podcasts and micro learnings that will be available for our families to access 24/7. It's really hard in today's world to be taking care of families and managing life in the world, going to a training and then remembering all of the things that you learned in a training. And so making sure that the information is digestible, it's accessible, and that we're giving you opportunities to go back and relook at certain topics. And so making sure that we have that just-in-time training and that it's not overwhelming. And so additionally, as our internal team grows within equity training and workforce development, we hope to have further Oregon-specific content for that just-in-time training. And so part of that evaluation of what we're doing is saying, is this the right content? What else do you need? And how can we support our resource parents over time, not just prior to certification, but continuing to grow out their skill set right alongside our workforce. So with that, I thank you for time to talk about RAFT. I'll be coming back to talk more about it in future meetings, and I'm going to turn it over to Lacey to talk about family preservation.
Thanks, April. I was just talking away on mute. Good afternoon, everyone. My name is Lacey Andreessen. My pronouns are she, her, hers, and I'm the Deputy Director for ODHS Child Welfare with the role of aligning program and practice across the state of Oregon. Thanks for taking some time to be with us this afternoon. I appreciate how busy you all are and that you take the time to meet and hear with us and give us feedback. So thanks for being here. I'm pleased to be able to give you an update on the implementation of family preservation within child welfare and self-sufficiency. For the last year, I think I've been coming to these and talking about the development, and today can report that we went live with the first 3 demonstration sites March 28th, and are working through the work in those sites with an intention to expand. Next slide, please. If you have not heard yet, I'm thrilled to welcome Jennifer Holman as our Family Preservation Program Manager. Likely many of you know Jennifer and have worked with her in a variety of roles. In her time with ODHS, most recently, she served as the Family Reunification Program Manager and led some really innovative and engaging statewide initiatives around family engagement, value-based practice, fidelity to the Oregon safety model. Some of the work in value-based practice we're launching off of to improve and develop family preservation. So I'm confident that she's the right person to sit in the role and be a leader. The three kickoff sites are Alberta branch of Multnomah, Douglas County, and Klamath County. And it was great to be with each of those teams. The attendance and the content of the kickoffs really reflected all of the work that the staff in the demonstration sites and in our central office team have done. Really collaborative relationships, both with our colleagues in self-sufficiency, but also community partners, Oregon's tribes, and people with lived experience and expertise. In each of the three events the day of Monday the 28th, it was great to see the attendance and the roster. We had a wide variety of types of folks from child welfare and self-sufficiency, but also the largest attendance that I've seen of community partners, members of tribes, people with lived experience, stakeholders. So what that testifies to me is that our teams really did a great job of engaging the local teams to make sure that everyone was there and really excited to be involved with and kick off the work of family preservation. This display shows you how we're thinking about this work toward becoming a family preservation system. We started with our vision for transformation, and then we're utilizing families, communities, and tribes, a collaborative team engagement model, and relying on that third bubble to my right, data and practice informed services. The services being developed currently that will be funded by Family First, and then also what we already have in terms of our in-home safety and reunification services and other community partnerships to build into a true family preservation system across child welfare and self-sufficiency programs. Next slide, please. We've had some great efforts in each of the counties, as I just alluded to. And these are just some of the examples of them. In Multnomah County, they held 6 community forums with really open-ended questions like what's working well with keeping parents in their home with children when we're managing safety, but also what are we missing or where do we have barriers? And then finally, how do other people in the community want to participate? So they've created those community forums, pulled together a report from the feedback that they got, thanked the people who partnered with us in those, and we've used that feedback to really inform the development across the 3 demonstration sites. And then in Douglas County, we're levying an important partnership that we already have, Children's Public-Private Partnership. Like many things, we of course needed to give that an acronym, CP3. And then they also did some community sessions and intend to have more in upcoming months. And in Klamath County, we really leveraged what has become a strong relationship with the Klamath tribe and other community partners. And just last week opened a new integrated building for ODHS in Klamath Falls. And so really learning from and relying on relationships they already have and really focusing on intentional growth, because we know in order to safely serve families at home, particularly when we're needing to manage child safety, that will be a community effort. That is not something that we own, nor do we want to. And so it's exciting to see where we're really leaning into current partnerships and also working on expanding to create this part of our system. Next slide, please. We're tracking data in the 3 sites. I anticipate soon we'll have numbers that we can begin really reporting out on and utilizing a true CQI process informed by good implementation science. So trying some things, having lots of avenues for feedback, adjusting, trying some more things, having lots of avenues for feedback and adjusting until we've honed in on the model that we think we can move across the whole state. And then the teams, both in self-sufficiency and child welfare in those 3 sites are getting some supportive training that will move out to the rest of our staff as well as we expand. They've gotten coaching, they've gotten some training about identifying families that can be served in home and will be candidates for Family First Preservation Services. They're really working on their preservation and assessment skills and value-based engagement. And next set of training that's coming up is the in-home criteria. I think next I'm kicking it over to Alicia to talk about some CQI updates.
Thank you, Lacey. I'm Alicia Cox. My pronouns are she, her, and I am Child Welfare's Deputy Chief of Strategy and Innovation. I like to always provide updates on our continuous quality improvement efforts, or our CQI efforts, because I'm always invigorated by the continued work on what we can do to improve and also build out the data literacy capacity of child welfare and, of course, our partners. Again, the CQI efforts, our continuous quality improvement efforts, are to actualize the guiding principle number 3, which is enhancing the structure of our system by using data with continuous quality improvement. Meaning we have data, what can we do, what trends, what information from the data are we getting to inform us on our practice, on our policy, and on ways so that we can improve the outcomes for children and families we serve. Next slide, please. And from the Workgroup Recommendations, which was a 6-month active work group in partnership with persons from the community and design and delivery, so persons in caseworker, in supervision, in program manager and district manager positions, and of course, persons with lived experience, really built out the recommendations on what they would like to see as a sustainable improvement structure. And from those recommendations, we've been implementing and working on finding a clear and consistent process, so that not only is it consistent, it can be replicated. So if we're doing continuous quality improvement in one district, that information can be shared through a feedback loop and, of course, practice or tweaked based on the information that they have in that particular district. And again, always using using information from our data to inform on how we're doing. Are we headed in the right direction for the outcomes that we're intending? If not, that gives us a space and opportunity to be reflective, gather feedback from our community partners and tribal nations and persons doing the work to incorporate those changes as the process is happening. So similar to what we're doing in family preservation, where we get feedback and implement it and tweak it, it will give us the robust system that's going to be meeting our needs and also improving those outcomes for children and families. So by using that feedback loop, which is one of those core tenets from our workgroup recommendations, we're really implementing the feedback and leaning on all of you in terms of experiences to provide the information necessary so we're not missing the mark and continuing to build out those silos in our improvements, but looking at the wide spectrum of experiences and diverse backgrounds to give us the information necessary to make the improvements that we want to see. Next slide, please. So then people ask, well, how is this continuous quality improvement effort different than previously? We have the support and structure. We were given positions from the legislature last year. We are now hiring persons and they've been hired. We have a continuous quality improvement manager to help maintain the work and create and define processes that will be here to stay. We hired Jennifer Ricks. She came in from the Office of Program Integrity, and she has a wealth of knowledge in our Children and Family Services Review, our CFSR, and she brings that critical knowledge on the definitions and the metrics that we're having to report out to our feds, but really the insights on the daily practice based on the qualitative and the quantitative data. So the measures and counts of the types of cases, the types of persons involved, but also the interviews that are for those persons who are in that particular case. So we're getting the whole story. We're not just looking at data and metrics, we're looking and talking with people and incorporating that information as part of our sustainable improvements long-term. Also, we have a consistent process and individualized plans as we reach out to the different districts across the state of Oregon. Is that continued collaboration and partnership with the persons doing the work and how their metrics might be, if they're not meeting or exceeding our federal measures, it's working through and figuring out what is best in that particular district across the state, because not all districts are the same. The demographics are different across the state, and being mindful of the persons and experiences that really truly are impacting the measurements is having that conversation and being accountable for that information. So that means we're being consistent in our process from one district in terms of strategies, but also having that individualization of the process so that we're getting the outcomes specific for that area. And then again, continued insight and input that is leaning on our CQI advisory committee, which is an ongoing effort, and having persons from delivery. We have about 18% from persons who are caseworkers, supervisors, persons in child welfare. we have 32% of persons with lived experience, and then non-ODHS is about 12.5% and 25% from design, which is persons who are defining programs and figuring out implementation. So it's the continued feedback loops that we have, because we're not going to get it right the first time, but we're sure going to incorporate the feedback and guidance that we all receive as we're having district plans come up and identify the strategies that will be implemented in the near future. Next slide, please. As part of that CQI advisory work group, we're also defining our data framework with these 4 areas of diversity, equity, and inclusion, data literacy, having clear and consistent metrics, and then transparency. These 4 areas is what's going to uphold the continuous quality improvement structure. So by prioritizing a wide range of voices, it's critical to the work that we're doing, because without your all's lived experience, programmatic experience, personal and professional experience, it's hard for us to make sure that we're on the right track. So by having a widened table to give the feedback and input and incorporate as part of our continuous quality improvement efforts, we can be sure that we're on the right track. And then with the recommendations by the CQI work group, we're really building out the clear and consistent metrics that are necessary, so we know what we're speaking to. We understand that we have access to the reports, we're being accountable for the data entry, the data is valid, and we're having to respond to the data in whatever state it may be. So as you may have known, that I announced a couple months ago and continually celebrate, is our Federal Performance Measures dashboard, which has our CFSR measures. So that's where you can see where we are right now. It's updated on a quarterly basis. So it's our first take, our first iteration of having public-facing data. My goal is to continuing to build out that dashboard with other metrics and other opportunities for us to share where we are with our data. And then in turn, when our continuous quality improvement structure gets underway, we'll be able to talk about the strategies to improve those outcomes. So you can see the linkage between the metrics and the outcomes. And of course, just being transparent as we continue to build out those data frameworks and resources, we'll be continuing to show up where we are, and then the improvements on how to improve those data points over time. Next slide, please. And it's very exciting that as we are building out our continuous quality improvement structure, we identified 3 sites in which we'll start implementation in August. So we have already had our site initiations with Douglas, Morrow, and Umatilla. You may have seen Douglas on the family preservation sites. They're one of the districts who have just been so supportive in the improvement efforts and to continue to support family preservation and using the data and information to inform us on our practice to make sure that we're getting to where we need in order to improve those outcomes. So very exciting that we're working with these 2 particular districts, but 3 sites on our implementation. I will have more information as we roll out. As the next time we have a chat, I should have some additional feedback and information that we received as we're sitting around and talking about implementation, because as you know, with continuous quality improvement, we're always gathering information to improve our next step. And I'm always open to ideas. So if you're interested in hearing more about continuous quality improvement, you're interested in how you can contribute to the Continuous Quality Improvement Advisory Committee, or you have some thoughts about our data, please reach out so that we can connect. And with that, I will send it over to Tim.
I believe we're going to start our Q&A session now. So I think we're going to start with Lacey covering the first question.
I think we're tag teaming it. Yeah. So our first question, this is April again. Our first question that we received, how will you be implementing parent voice in future planning, or how have you already? I love this question. Part of the vision for transformation is absolutely centering the voices of those with lived experience and lived expertise. And I think that there are areas where we have strengths and we have lots of areas for improvement. But part of the building of the infrastructure as a part of the vision for transformation We have a equity team on my team that really part of our charge is deeper community and tribal engagement. And we are, going to be recruiting a service equity manager to work in our Office of Equity and Multicultural Services team that is also going to be focused on community engagement. So we are really about to kick off deepening our efforts to partner with and include the voices of those with lived experience. But I do want to highlight a couple of areas where we are already partnering with parents. And so we have just a wonderful group of parents that we work with on our Parent Advisory Council. We meet regularly with our Parent Advisory Council partners, and they bring things to us that are working well around the state, and also areas where we have, steady needs for improvement. We have representation on our Child Welfare Advisory Council of parents with lived experience and resource parents. That meeting is also open for the public. And so if there are folks from the community that want to participate in the Child Welfare Advisory Council, we have a link in the chat where folks can join that engagement. We also partner with organizations that work with parents, like our Morrison Child and Family Services. I see that we have some of our folks from there are with us today, and really appreciate your partnership and your voice. And then we have many folks with lived experience, including parents that are involved in our family preservation implementation process, the design, the planning, and their demonstration sites. And we've had community forums that are happening with parents. We've even had parents that have been involved in hiring processes and out in the delivery side. And so really excited about how we can continue to grow our opportunities to have parents with lived experience in the design and planning, even hiring and selection of our staff. We also have, as Alicia mentioned, our CQI advisory committee has parent voice on it. So we've got lots of things that are happening that are coordinated out of central office where parent voice is included. Again, we're going to continue to grow that. But I wanted Lacey to maybe talk a little bit about how current parents are currently involved within practice. Lacey?
Thanks, April. Hi again, Lacey Andreessen. So one of the things that we're really working through is both what April just described, which is parents who've experienced the system and moved on, getting their cooperation, partnership, and feedback, but also being intentional in where and how we're engaging with parents who are currently experiencing the foster care system and have their children in foster care, or we're serving them at home. And we've got a couple different efforts so far that I just want to talk with you a bit about in that realm. So one is we have developed a model for family meetings that's a value-based practice, one of those practices being parent-driven, youth-guided. And we have a lot of intentionality in how parents are engaged in preparation and the creation of that agenda, and then making those spaces a place where a parent truly feels like they are a collaborator, a partner, and hold some power in decision-making and case planning for their families. Another example I would point to is one of our districts is doing kind of a re-envisioning of what we used to call visitation, what we're moving to the term family time is, and how that's specific to engaging parents. They have a person who facilitates a meeting very early on in the case, best case scenario, day after removal, with anyone who can be involved, resource parents, attorneys, support people, whoever might be able to be there, to plan for what their schedule for family time is going to look like. And they're tracking that effort. And so what we can point to is when a parent is engaged at the beginning, planning for their contact and time with their children, they're getting more time with them, and they're also showing up more frequently. And the third effort I would point to is when we rolled out the family report, a document that we use for planning with families, and the statewide case transfer process, one of our consultants reached out to parents who had gone through that process to get their feedback about what it was like and how they participated and if they have suggestions for improvement. And then finally, you heard Alicia talk about CQI and our child and family service reviews. When those are happening, the reviewers on cases reach out to parents if they're available to also get their feedback as they're making the findings around the cases. So we're new at this, but it's exciting to see. I think some of our best work has come when we've had people with lived experience and expertise, including partners at the table. And I'm really excited to see how we'll continue to expand it.
I think the next question goes to me. The question is, when collecting data, do you break down data by child and family's race? And how do you use this data? So I'll answer this two-part question. In general, yes, we do collect data on race and ethnicity. You can see from our federal performance measures dashboard that and the measurements that are captured there, it does include race and ethnicity, and you're able to look over districts as well. So if you want to look for a particular district, you can get that information. We don't drill it down any further beyond that because we want to have some confidentiality around the data. So if it's going to be less than a certain number, I believe the number is 9, the information is not shared, but otherwise you can see race and ethnicity in the data for our dashboards. And then of course, as part of our data literacy approach, we are doing assessments of how the data is collected. And the data is only as good as it's entered. So identifying what the process is, figuring out what are the challenges and barriers around entering the data, and then of course working through so we can get it accurate and timely as well. And then as part of the CQI advisory, we've had persons from the community share back their reflections on data and data usage. And as part of that has been really eye-opening. I see a couple persons on our call today who are part of our CQI advisory, so they wanted to in the chat talk about their experiences. But I do find it to be critical as we have persons with lived experience and different backgrounds talk about how we're using data in a way that's equitable, meaning we're looking at our data. What story does it tell when we are slicing it and dicing it into different components and different categories? What is it telling us that in areas that we need to improve? So going back to our data equity strategy plan, it's looking at the whole story and not just a number. And I think that's been very enlightening and invigorating in the work that we're doing. It also gives us insights on our areas for improvement, on the places that we need to improve, and so that we can better understand the children and families we serve, and then how we can connect them to services and supports that align with their cultural background, and then using that data to identify whether there are disparities or disproportionality in our data, and then of course the disparities that are associated with that. So again, in the future, child welfare is working with the Oregon Department of Human Services, which is our umbrella agency. They're working towards capturing more information beyond what we already have, because the categories that we have are from the feds, and that's how they collect data. So we're limited in that realm. However, there is a movement towards getting more information on sexual orientation, gender identity, and expression, or SOGI, and race, ethnicity, language, and disability data, which is Real D data, and incorporating that across the agency as a data collection process. And of course, giving us better information about our particular kids in care. Next question to you, Lacey.
Thanks, Alicia. We received a question asking about what post-permanency supports are available for parents, resource parents, relative caregivers who become legal either guardians or adoptive parents. And we have an array of services that are available. So the first is we provide, in most cases, monthly financial support via an adoption or guardianship assistance payment. And then we also have staff who administer those payments and also can help families navigate the systems, answer questions, help with things like adjusting insurance, assignments, some of those kind of things. We also have a really strong partner with Oregon Post-Adoption Resource Center, and they do everything from training and learning libraries for resource parents and adoptive parents and guardians. They also will assist in helping to find trained therapists for children in our care and custody, and then post-permanency. They can connect with a family support specialist. And then they also they are the entry door for referrals to Intercept. And Intercept is an intensive in-home parent-child interaction intervention that can assist parents when they're struggling with behaviors or whatever might be happening in the home. They at minimum do 2 in-home visits per week, but they also have a commitment to being a 24/7 response. So that's really for our highest level of need for children and young adults who are in a permanent placement. We also offer support groups both through ORPARK as well as KEEP. And then we have some opportunities for the Oregon Kinship Navigator program. And finally, we have a strong partnership with a team called Bridge Meadows. They develop high quality, affordable housing. It has wraparound services and supports and some therapeutic components. And then it's also built on an intergenerational model where there's older people who live there and do some partnering around the amount of time that they'll spend with families. And those are open to any family who have completed a legal adoption or guardianship through our agency. Well, lucky for you, it's going to be a lot more Lacey today because the next question is for me as well. We received some questions and inquiries about who to connect with within child welfare if you are a resource parent and you need additional support. Another one of our strong partners, Every Child, has developed the My Neighbor program for tangible needs that you may have. Your certifier, your champion position, and also online are all places you can find information on how to connect with Every Child and My Neighbor. You heard me reference earlier, and I'll say it again, the KEEP support groups. They're affinity groups for resource parents and relative caregivers that really give you opportunity to meet some peers, build some relationship, and also get some input and feedback about suggestions and ways to address and help children and young adults. If you're having issues that are case specific, outside of just the caseworker, we have supervisors, program managers, and district managers. Please utilize those people if you're needing some assistance or help or explanation in terms of what's happening for the planning for children or young adults in any given resource home. And then I would also add, we have the Governor's Advocacy Office, and we have an ombudsman specifically dedicated to serve children and young adults in foster care. And that's an avenue for support or assistance if you're not getting what you need from the agency. And finally, you can connect with the Oregon Resource Family Alliance. That was previously known as the Oregon Foster Parent Association, or their local chapter, to find out what's available within your own community and what opportunities they may have to help you navigate as well.
So that's what we had for our previous questions. Are we seeing any questions in the Q&A that we want to address right now? Looks like we have time for maybe one.
I see a question here. Are satellite training locations like the Boys and Girls Aid utilizing the updated RAFT training information? So we have engaged many of our partners. We are planning to have our partners supporting RAFT, as well as folks who had been previously offering foundations training. So the answer is yes. And we are going to be looking at expanding our ability to make sure that all of Oregon can access those trainings. So whether it's using and leveraging our staff in regional offices to train. And so we've been building out some of our internal team and saying, I don't need a training team sitting in Salem. I need a training team out in the state, building relationships with the community, and thinking about where we could be hosting more training events and opportunities. So stay tuned for both more offerings from some of our partners and expanding our ability to be able to serve folks in person across the regions.
I'll take a swing at it. There's a couple of questions that have come in around the size of caseloads and workforce. And we're really building out right now our own internal capacity to track and understand caseloads across the state, and then utilize that information to leverage what we need and how we describe that. We have had a reduction of children in foster care, and so those caseloads by and large have diminished significantly. We continue to analyze both what we may need in terms of family preservation staff and what we need for protective services and screening. So we're using the data to inform those decisions and assisting our delivery managers and utilizing the data and how they resource their districts and branches as well.
There's some really good questions in here, so really appreciate them. I'm going to take another one that I see in here that I can answer quickly. The question is, are there any updates that you can provide regarding the involvement of juvenile justice organizations in collaborative training opportunities and the use of motivational interviewing as a FFPSA prevention activity? We are absolutely motivated to join in partnership around things like motivational interviewing. We have just hired a staff focused on motivational interviewing within our training team. We are going to be asking partners to come to the table with us to think about ways that we can partner, that the state can sponsor training for trainers, all of the things, and juvenile justice is absolutely top of the list for us to reach out to. So if you are interested in participating in that conversation or have other partners who you think might be interested in thinking about collaborative training related to motivational interviewing, we would love to see you reach out to the director's office email or even just put your information in the chat, because we are going to be jumping into that this summer. Really appreciate that question. Lacey, Tim, Alicia, do you see any others that we can answer quickly? There's one question about, and I'll say this before we kind of wrap up. Do you contribute the lower number of children in care directly to the family preservation work, or is it a result of changes from the pandemic? I'm new to Oregon, and so I can't really say all of the contributors to our lower numbers of children in care, but I tell you what, we really want to be able to associate lower numbers of children being served in out-of-home care to our preservation work. And so we're looking to continue to decrease our numbers of children served in out-of-home care and increase the numbers of our children served in home. And so we will be excited to come and make that correlation with you in the days, months, weeks, and years to come. We have just kicked off our family preservation site, so probably not, but I'm really looking forward to being able to answer that definitively as we continue to support family preservation. I don't know that there's a correlation between the pandemic and lower numbers of children in care. That decline has been a trend, that was happening before the start of the pandemic and continues. I don't know, Lacey, if you want to add anything to that.
I would just add one other thing on that pandemic specific question. We, especially in late 2020 and early 21, were asked a lot about whether or not there were children who were unsafe or were missed during the time when they were seeing less mandatory reporters and the world was kind of closed down. And the data that I look to answer that question is not the number of calls received to the hotline. It's the trending number around founded dispositions and then children needing to be removed. And what we can see throughout 2020 and 2021 is that data, regardless of number of calls, which fluctuated greatly there for a couple of months, the founded and removal data of children stayed very consistent. And so what I believe to be true is that we got to the families we needed to get to, because we didn't see a significant dip in the trends around that data.
And April, I would just add that while family preservation is just kicking off, we've had the vision for transformation in place for a while, and that has led us in the direction of encouraging our staff to find successful ways of keeping kids in home while being safe at the same time. So I think we can say there is a correlation there pretty safely. So really excited about the work that we've been doing over the last couple of years, but more excited about what's to come as we implement these things that we talked about today.
Yeah, I would agree. Thank you, Alicia. Vision for transformation equals less children in care, more children served in home, and our staff and communities have what they need so that children can be okay and thrive. So we have arrived at our final minute of this iteration of the Community Connection. I wanted to just thank you all for attending and for your wonderful questions. We wanted to just thank you for your continued feedback on how we can make these community connections better and more useful to you. You will get a survey link after the meeting ends. So again, thank you for taking time to join us today. We look forward to connecting with you again. We will see you in July for Unification Month. And until then, feel free to reach out to the Child Welfare Director's inbox for suggestions, thoughts, worries, questions, comments. Have a great day. Bye.
Thank you all.
Yeah.